Hey everyone, so we'll be starting with 15th part of anesthesia. So in this we'll be talking about BLS. So BLS is nothing but basic life support. So starting with it, first we will have to verify the scene safety. So verify scene safety. Then we will be checking responsiveness, check responsiveness, then call for help, then activate emergency response, and then send someone for AED or DFib. So this is how you will be doing BLS initiation. Next, check for breathing, pulse, gasping and all for 10 seconds only. 10 seconds. So if breathing is actually absent but pulse is present, then we'll be giving 10 breaths per minute. So this is what we do, and we will be monitoring the patient until advanced life support comes. And next, we will be checking for carotid pulse. Check for carotid pulse. In children, we will be checking for brachial pulse. So if there is no breathing and pulse is also not there or felt, so we will be starting with CPR then. So starting with CPR, we will be giving 30 compressions and 2 breaths. So it is in 30:2 ratio. And then we'll be using defibrillator. Also check for opioid overdose possibility. Now we will be putting patient on left lateral decubitus position, which is a rescue position, and in case of 2 rescuers also we'll be using the same ratio. However, if it is a child, then we'll be using 15:2 ratio, like with 2 rescuers. Then we will get AED. So after AED comes, check whether rhythm is shockable or not. So if it is yes, it is shockable, then it is no. So yes, then resume CPR, and immediately after 2 minutes put defibrillator again and continue to do this until advanced life support comes. If no, it is not shockable, even then also you'll be continuing it for 2 minutes, then you will be waiting for ALS. So advanced life support will be a crucial waiting point after the CPR. Now we'll be talking about few rules. So BLS or universal termination of resuscitation. So when will you stop resuscitation? So if you did not see any arrest, like cardiac arrest, you did not see any cardiac arrest, and there is no return of spontaneous circulation, and it is not shockable, or you can't give shock at that moment. So if all these are present, then you will be stopping it. If even if these are not present, then you will be continuing the CPR. Now we have chain of survival, which is a process of steps like activation of emergency, then beginning CPR, then doing defib, then doing ALS, then post cardiac care and recovery. So this is chain of survival. Yeah, now we'll be talking about ACLS, that is advanced care life support. So we'll be talking about ACLS, which is advanced care life support. Here we'll be starting with CPR, and we will have hospital setup. So we'll be having bag mask ventilation, and we will have to give oxygen, and monitor is attached along with defibrillator. These are the things that are present. Now we will be checking the shock, whether it is rhythm is shockable or non-shockable. If yes, then it might be ventricular tachycardia or ventricular fibrillation. If no, it is pulseless electric activity or asystole. So in this, you will be accessing IV or intraosseous route, and you will be giving epinephrine after 2 minutes CPR. After 2 minutes CPR is done, epinephrine is given for 3 to 5 minutes, and again capnography is done, and we'll give shock again. We'll check whether it is rhythmable or not. Rhythm is shockable or not. Now we'll give amiodarone or lidocaine also we can give, and then treat the reversible cause. And if in case it is a no, then also we'll give epinephrine, then we'll do CPR, then we'll check for the shock and rhythm. Then if there is no sign, then we will have to go for cardiac arrest care. Go post cardiac arrest care has to be done, and continue resuscitation. If there is a shock, it is rhythm is shockable, then we'll be working like in same step, like how we did here, like epinephrine and amiodarone and lidocaine and all. So this is how you do advanced care life support. Now we'll be seeing about pregnant and specific now. So pregnancy. So in pregnancy, start BLS, but there are few rules like you will have to do high quality CPR, and left lateral decubitus position has to be done for uterine displacement, and DFib is used. Now activate this cardiac arrest pregnancy team, and you will be if you are giving patient IV magnesium, then stop it, and you will have to give calcium. Then detach all the fetal monitors that are present, and you will have to do blood transfusion if it is required, and avoid amniotic embolism. Now prepare for resuscitative delivery when fundal height is at above the umbilicus. So goal is to deliver by 5 minutes. If there is no failure of this, now continue ALS, and you will have to do newborn infant resuscitation as well. So this is how you deal with it. So we'll not take the patient to OT, or will not do C-section, LSCS, or will not do other Fenelstein incisions also. We'll be doing post for perimortem C-section directly. Okay, so this is how it is. Now we'll be seeing last topic, that is neonatal resuscitation, next part.